Evening, everyone. My name is Jasmine Anderson. I am an immunization education specialist for the Partnership for Maternal and Child Health of Northern New Jersey. Thank you all again for joining tonight's webinar on adolescent immunizations. April 1st through April 5th is Adolescent Immunization Action Week. This week is to encourage adolescents and young adults to stay up to date with recommended vaccinations. This activity is supported in part by the New Jersey Department of Health Vaccine Preventable Disease Program. Participants will be able to explain what vaccines are and how vaccines work, discuss why adolescent immunizations are important, name which vaccines are recommended for adolescents, and identify which vaccines are required for New Jersey schools. These are all of the diseases adolescents can be protected from. COVID, HPV, whooping cough, meningococcal disease, and influenza all have vaccines that are recommended for adolescents. And those are the diseases I'm going to discuss more about later on in the presentation, as well as their vaccine recommendations. Adolescents should have received vaccines for the other diseases listed here as young children and babies. If adolescents missed any vaccinations, they are able to catch up. They just need to speak with their doctor or healthcare provider. There are currently outbreaks happening with vaccine preventable diseases, one of those being measles. 97 cases of measles have been reported in 2024, including cases in New Jersey. 59% of those cases were unvaccinated individuals, and most of the cases were made up of children under the age of 5. We also see that a good number of cases were cases in adults. These adults were more than likely not vaccinated or under-vaccinated. This underscores the importance of childhood and adolescent vaccinations. There are also reports of pertussis outbreaks from New York, California, and New Jersey in 2024. Again, this highlights the importance of childhood and adolescent vaccination. Now I'll take you through an overview of vaccines. We'll discuss what vaccines are, how vaccines work, why adolescents should get vaccinated, the recommended immunization schedule for adolescents, and New Jersey's immunization requirements for attending New Jersey schools. Vaccines are safe, simple, and effective tools that protect us from pathogens before we encounter them. Pathogens are viruses like the flu or COVID-19, or bacteria like tetanus and meningitis that can cause disease. The following video explains exactly how vaccines work.
When your child gets a vaccine, an amazing thing happens. Just like a teacher, the vaccine gives your child a lesson. The immune system gets to work right away, learning what to do if your child is exposed to harmful germs. All of us are exposed to germs every day. Some might cause a cold or a minor illness, but then there are more dangerous viruses and bacteria that can make children very sick. Diseases like measles, diphtheria, and polio used to sicken and kill thousands of children. That's why it's important to get vaccinated, so your immune system will know what to do. Here's how that works. Vaccines contain either an antigen, a piece of the germ, or some instructions that tell us how to make the antigen. They teach your immune system to produce antibodies to get rid of the virus or bacteria. Then those antibodies remember what to do if your child is exposed in the future. Vaccines can work in a few different ways. In some vaccines, the antigen is a virus that has been weakened. This means it will not be able to reproduce in your body to make you sick. But it does a great job of teaching your immune system to be ready for the real thing in the future. Other vaccines use a virus that has been killed, a tiny piece of a virus or bacteria, or a weakened form of a toxin, like the kind produced by the bacteria that cause diphtheria and tetanus. Same thing, it can't make you sick, but it teaches your immune system to recognize the germ. Getting one or more doses of a vaccine later on gives the immune system a memory boost so it remembers what to do. The recipe for most vaccines is pretty simple. Besides the antigen, some vaccines contain aluminum salts, which help make the antigen work better, so children can get a lower dose. The amount of aluminum in vaccines is small, much less than your child gets from everyday food and water. Some vaccines also include a preservative to keep germs out and tiny amounts of other ingredients, all very safe. After your child gets a vaccine, their arm may feel sore or they may get a fever. That's a sign your child's immune system is getting stronger. After the vaccine does its job, it leaves the body and is gone. A week or two later, your child's immune system is better able to protect your child. Remember, vaccines have been given to millions of children and teens. They are closely studied, and we know they are safe and effective. In fact, vaccines work so well, most reduce your child's risk of getting these diseases by 90% or more. It's an amazing way to protect your child so they can stay healthy and safe.
There are three reasons why adolescents should get vaccinated. Number one, to protect against diseases and infections where the risk of exposure increases as adolescents get older. Number two, to boost protection. Because protection from vaccines can wane, additional doses of some vaccines are recommended. And number three, to protect those around you who are not able to get vaccinated, like young babies and those who are immunocompromised. Those who can get vaccinated help prevent the spread of pathogens to those who can't get vaccinated. This is the 2024 immunization schedule for children and adolescents 7 to 18. It was developed by the CDC, the American Academy of Pediatrics, and the American Academy of Family Physicians. It's important to follow the recommended immunization schedule for several reasons, but the most important reasons are that this schedule takes into consideration the most ideal timing for when children and adolescents should be protected. And the schedule ensures that children and adolescents receive early and long-term protection. Later in this presentation, I'm going to dive deeper into HPV, Tdap, meningococcal, flu, and COVID. So let's talk about other reasons why why you should follow the recommended immunization schedule. Again, as I mentioned, ideal timing. The schedule is based on how adolescents' immune systems respond to vaccines and how likely adolescents are to be exposed to a particular disease. Number two, to prevent complications. Delaying vaccines could leave adolescents vulnerable to diseases that can cause serious complications. Number three, early protection. It's best to vaccinate before adolescents are exposed to dangerous diseases. If you wait until you think adolescents could be exposed to a serious illness, like during an outbreak, there may not be enough time for the vaccine to work. Number four, best protection. Adolescents won't have the best protection from serious vaccine preventable diseases until they get all the recommended vaccine doses. Number five, long-term protection. Many vaccines offer lifelong immunity against diseases. And lastly, number six, spreading illness. Adolescents who are not vaccinated on schedule are not only at risk of getting sick themselves, but they can also spread illness to others who aren't protected. Here's a list of immunizations that are required to attend a school in New Jersey. Polio, measles, mumps, rubella, chickenpox, hepatitis B, meningococcal, and Tdap vaccines are all required to attend any K through 12 school in New Jersey. Adolescents should have received polio, measles, mumps, rubella, chickenpox, and Hep B vaccines as children. However, if they did not, they are able to catch up. So now we're going to dive deeper into the vaccines that are recommended for adolescents and the diseases that they protect against. We're going to talk about HPV, meningococcal disease, tetanus, pertussis, and diphtheria, flu, and COVID-19. So beginning with HPV, HPV stands for human papillomavirus. It is the most common sexually transmitted infection. 9 out of 10 people will be exposed to HPV at some point in their lives, and 8 out of 10 people will actually become infected with HPV at some point in their lives. It is extremely common. Most new cases of HPV are made up of adolescents and young adults. HPV can cause cancer and genital and oral warts. There are over 200 types that are classified as either high risk or low risk types. High risk types are associated with cancer, and low risk types are associated with genital and oral warts. There are no symptoms for HPV infection, which means that it can be transmitted unknowingly. There is also no test to find out a person's HPV status. People may find out that they have HPV from abnormal pap smears, when they get genital or oral warts, or after cancer develops. HPV is transmitted through any kind of intimate contact, including vaginal sex, anal sex, oral sex, genital to genital contact, and even just touching. The risks of HPV infection include the following cancers: cervical cancer, which is the most common HPV associated cancer in people with cervixes; penile cancer, which is the most common cancer, most common HPV related cancer in people with penises; anal cancer, vaginal cancer; oral pharyngeal cancer, which is cancer of the mouth and throat; and vulvar cancer. There's also a risk of getting genital and oral warts. It is recommended that everyone between the ages of 9 and 45 receive the HPV vaccine. For adolescents, it is strongly recommended that the HPV vaccine series begins at age 9, because there is a greater immune response at age 9. The HPV vaccine is a cancer prevention tool. It protects against 9 HPV types that cause cancer and genital and oral warts. It is over 90% effective in preventing HPV-related cancers and warts. Next, meningococcal disease. Meningococcal disease is caused by the meningococcus bacteria. Two types of infections that develop as a result of meningococcal disease are meningitis, which is an infection of the brain and spinal cord, and sepsis, which is an infection of the bloodstream. Symptoms of meningococcal disease include sudden onset fever, headache, stiff neck, dark purple rash, drowsiness, shock, and coma. It spreads through direct contact and the air. Risks include loss of limb, deafness, nervous system disorders, developmental disabilities, seizure disorder, stroke, and death. There are two meningococcal vaccines that adolescents can get. The first is the MenACWY vaccine, which protects against 4 different types of the meningococcus bacteria. And the second is the MenB vaccine, which protects against a different type of the meningococcus bacteria. It is recommended that adolescents receive 2 doses of MenACWY, 1 dose at ages 11 to 12, and another dose at age 16. For those at increased risk for meningococcal disease, the MenB vaccine is recommended at age 16 to 18, in addition to the MenACWY vaccine. You can choose to have your adolescent vaccinated with both MenACWY and MenB. The vaccines can be administered together in a combination vaccine called MenABCWY, but it is strongly recommended that you speak with your child's doctor or healthcare provider to determine which course of action would be best for your adolescent. Next, diphtheria. Diphtheria is from a toxin. It's caused by a toxin from a bacterium that makes it difficult to breathe and swallow. It attacks the heart, kidneys, and nerves. Symptoms include sore throat, mild fever, weakness, and swollen neck glands. Diphtheria spreads through the air and direct contact. Risks of diphtheria include swelling of the heart muscle, heart failure, coma, paralysis, and death. Tetanus is a toxin from a bacteria that lives in the soil and causes lockjaw. Tetanus is the only naturally occurring vaccine preventable disease, and it does not spread person to person. It spreads through breaks in the skin, which includes wounds, puncture wounds, and burns. Symptoms include stiffness in neck and abdominal pain, abdominal muscles, difficulty swallowing, muscle spasms, and fever. Risks of tetanus include broken bones, difficulty breathing, and death. Pertussis, also known as whooping cough, is a bacteria that causes violent coughing fits. Symptoms include severe cough, runny nose, and apnea. It spreads through the air and direct contact. Risks include pneumonia and death. It is recommended that adolescents receive one dose of the Tdap vaccine, which protects against all three diseases. The Tdap vaccine is the same vaccine as the DTaP vaccine that babies and children and pregnant women receive. There are just smaller amounts of some of the vaccine components in the Tdap vaccine in comparison to the DTaP vaccine. This Tdap dose is in addition to the 5 DTaP doses babies and children receive. Seasonal influenza, or flu, is an upper respiratory virus that infects the nose, throat, and lungs. Symptoms include fever, muscle pain, sore throat, cough, and extreme fatigue. Flu spreads through direct contact and the air. Risks include pneumonia, bronchitis, sinus infections, ear infections, and death. A common misconception about the flu is that it is not a serious illness, especially for children and babies. However, that is not true. Children can develop serious complications from the flu, can be hospitalized, and the flu can even be fatal for children. There have been 126 pediatric flu deaths so far this flu season, 88% of those children being unvaccinated and ranging from ages younger than 6 months to all the way up until 17 years old. It is recommended that everyone, including adolescents, receive one flu shot annually by the end of October. Flu viruses are constantly changing, and the flu vaccines are reviewed and updated each year based on the most frequently circulating flu strands from the previous flu season. And lastly, COVID-19. COVID-19 is a disease that causes mild to severe respiratory illness. Symptoms can include fever, muscle aches, sore throat, dry cough, headache, nasal congestion, fatigue, runny nose, diarrhea, vomiting, new loss of taste or smell, and loss of appetite. There can also be no symptoms. Risks of COVID-19 include pneumonia, respiratory failure, blood clots, bleeding disorder, injury to liver, heart, or kidney, multisystem inflammatory syndrome, post-COVID syndrome, and death. COVID can spread through the air and direct contact. It can linger in the air for a long period of time. The current vaccine recommendation for adolescents is that all adolescents should receive one dose of the updated 2023-24 Pfizer or Moderna vaccine, or 1 to 2 doses of the updated Novavax vaccine, regardless if they were previously vaccinated against COVID or not. For adolescents who were previously vaccinated, they can get Pfizer, Moderna, or Novavax, regardless of what they previously received. Next, we'll discuss what to expect when getting a vaccine, including common side effects, vaccine ingredients, combination vaccines, immunization records, and the Vaccines for Children program, which provides vaccines at no cost for eligible children. And we'll discuss more about that program in a few slides. Any vaccine can give side effects, and side effects will vary depending on the vaccine given. The side effects on this slide were found to be the most common vaccine side effects in children and adolescents. Most side effects from vaccines are mild and will resolve within 2 to 5 days. The side effects usually occur within 12 hours of being vaccinated. Serious reactions to vaccines are rare, but you should contact your healthcare provider if your child is exhibiting any symptoms that concern you. As the video mentioned, every ingredient in vaccines serves a purpose. They do one of the following: provide immunity, keep the vaccine safe and long lasting, or they make the vaccine more effective. Many vaccines can be given together in what is called a combination vaccine. As I mentioned when I discussed the meningococcal vaccines, combination vaccines take two or more vaccines that can be given individually and put them together into one shot. So at a doctor's visit, your child may only get 2 or 3 shots to protect them from 5 diseases instead of 5 individual shots. Combination vaccines do not lower the efficacy of the vaccines. They're just as effective as individual vaccines. As I mentioned, the meningococcal vaccines are available in a combination of vaccines, and the measles, mumps, rubella vaccine is actually another combination vaccine. There are several benefits for combination shots for children and for parents. For children, it means fewer shots, less pain and discomfort, and on-time protection. Oftentimes, and we'll revisit this point when we review frequently asked questions. Oftentimes parents ask to space out the vaccinations for different reasons. However, spacing out the vaccinations could mean more time that your child is unprotected, more visits to the doctor, and repeated pain and discomfort. And so combination vaccines are the way to go. For parents, the benefits of combination vaccines are fewer trips to the doctor, less hassle and cost, and less time off of work and family activity. Here's where you can get your child vaccinated. Because these vaccines are recommended vaccines by the Advisory Committee on Immunization Practices, or ACIP. These vaccines are covered by most insurance companies. For those who are uninsured or your insurance doesn't cover all vaccines, you can visit your local health department, a public health clinic, or a federally qualified health center. The Vaccines for Children program is a federally funded program that provides vaccines at no cost. Vaccines are free, but clinic sites may charge an administrative fee. No one can be refused vaccines if admin fees cannot be paid. That was a very new update from that the NJDOH shared last month. So no one can be refused vaccines if admin fees cannot be paid. To be eligible to receive a vaccine under the VFC program, your child must be under the age of 19, Medicaid eligible, uninsured or underinsured, or Native American or Alaskan Native. To get your child vaccinated under the VFC program, you can go to a federally qualified health center, a local public health clinic, or a local health department. You can also ask your child's pediatrician or healthcare provider if they participate in the VFC program, but be sure to inquire about any costs. It is extremely important that you keep track of your child's immunization record and keep it up to date. Immunization records are needed for schools, colleges, and childcare, extracurricular activities, traveling, adoption and fostering, and even when your child becomes an adult. You can keep track by maintaining and keeping safe your own copies of your child's records. You can ask your child's doctor how they keep vaccination records. You can also ask them to enter all of your child's records into New Jersey's official immunization information system, NJIIS. Doing so makes your child's records even more accessible. And luckily for New Jerseyans, we have an app called Docket where we can access our immunization records from our phones. You can download Docket from your app store. It is available for Apple and Android users. The CDC has some tips that can be used to help make shots less stressful for your adolescents. Number one, do your research. Read up on the recommended vaccinations for your adolescents so you know what to expect. You can also talk to your child's doctor. Number two, be honest and calm. Take time to explain to your child what to expect in simple terms and use calming language. And number three, use distractions. You can have your adolescent look away. You can give them fidget toys, fidget spinners, something to squeeze, or use other distractions to keep them calm and take their mind off of the immunization. So here are some frequently asked questions that parents ask about vaccines. Are vaccines safe? Yes, millions of children and teens safely receive vaccines each year. Numerous studies have shown vaccines to be both safe and effective. Do vaccines cause autism? No, this is a common misconception. Scientific studies and reviews continue to show no relationship between vaccines and autism. Will a vaccine make my child sick with the disease? The risk of disease from vaccinations that use weakened live viruses is very small. It is impossible to get the disease from any vaccine made with dead bacteria or viruses or just part of the bacteria or virus. Should my child get shots if they are sick? Children can usually get vaccinated even if they have mild illnesses. Of course, you should talk to your child's doctor and follow their recommendation regarding vaccination. Can shots be delayed? Anytime you delay a vaccine, you leave your child vulnerable to vaccine preventable diseases. Why are multiple doses needed for each vaccine? Depending on the vaccine, more than one dose will be needed to build high enough immunity to help prevent disease or to boost immunity that fades over time. Your child may also receive more than one dose to make sure they are protected if they did not get immunity from the first dose, or to protect them against germs that change over time, like the flu. Is natural immunity better than vaccination? Nope. It is better to prevent sickness by getting vaccinated rather than getting an infection. Vaccines also lower the chances of spreading a disease. And as we reviewed, a lot of these vaccine preventable diseases have serious risks and complications. And so it is way better to get them vaccinated than to, open them up to natural immunity. And lastly, if a disease is not present in my community, do I still need to vaccinate my child? Yes. Even if a disease is not present in your immediate community, it may be present in other parts of the world, and your child can encounter the disease from someone who traveled. And that is exactly what happened with measles, actually. Measles was declared eliminated in the US in the year 2000, meaning that it was no longer circulating in the US. However, measles was still prevalent in other parts of the world. And so what was happening with the outbreaks is that people were traveling, vaccinated people were traveling to other parts of the world and were infected with measles, came back, and measles began spreading again in the United States. So even if the disease is not present in your community, you still need to vaccinate your child. There's a lot of misinformation and disinformation on the internet everywhere, so be sure that you are getting your information from trusted sources. Here's a list of trusted sources whose websites you can visit to get more in-depth information. Several of these I've used as sources for today's presentation, and then others just offer some really fascinating information as well as information that is easy to understand. So, are there any questions? You are welcome to unmute or drop questions in the chat if you have any. If there are no questions at this time, I'm going to go ahead and wrap up the presentations. Thank you all for joining me today. This is my contact information should you have any questions that do come up, or if you need assistance locating a location where your child can get vaccinated. And so thank you again for joining me all today. This week again is Adolescent Immunization Action Week. And so it is important that we are staying on task to ensure that everyone is protected.